Assalamu alaikum. Good evening and welcome to another Facebook Live via the NHS in Leeds. We are absolutely delighted to be with you tonight, and over the next 1 hour, we hope to talk to you about COVID-19 vaccine and Ramadan, its relevance when fasting. There are approximately 1.9 billion Muslims around the world, and there is little global information about vaccine hesitancy during Ramadan. And this session, we will hope to help inform communities whilst they are fasting and what is permissible during the fast. I want to just take a moment to celebrate the fact that in Leeds, we have now vaccinated over 250,000 people, and we continue that massive effort. Let me thank all the people that have been involved, whether that's clinicians and volunteers across the many sites in Leeds and Yorkshire. Our panel tonight is Qari Asim, MBE and Imam of Makkah Mosque, just up the road from where I am at Woodhouse Medical Practice, also chair of Mosques and Imams National Advisory Board, MINAB. We've also got Dr. Najib Rahman, who is a consultant in emergency medicine. And last but not least, we've got Dr. Henna Anwar, who is a GP registrar. And I want to welcome the panel, thank them for their time. And I hope that this is going to be an engaging and wonderful session where you will be able to make the right choices for you. We will start off by talking about the importance of having your vaccine whilst fasting. And the second part of our session tonight will be tackling some of the common questions that we hear and keep hearing. So stay tuned for that. The format will be, we're going to be with you for about an hour, and we've already prepared some questions and answers today. They are correct and following the clinical guidance that has been available to us. I do need to say that if you have a specific clinical question or query or worry that cannot wait, then emergency services, NHS 111 or your local provider, or if it can wait, then please contact your GP or the relevant professional that may be able to help you. So we are unable to give you specific individual advice, but more sort of broad advice around the COVID-19 vaccination program, and in particular today, Ramadan and fasting. I do want to just give a summary, and I'm sure many people will be aware of the vaccination program that is going on. And we do have two types of vaccine that are being rolled out and used at the moment. And these are the Pfizer Biotech and the Oxford AstraZeneca. Both of those require 2 doses. And Moderna is coming quickly onto sites as well. It's important that you have both your doses so that you have maximum protection against COVID-19. And it's really important that you remember hands, face, and space, even though you are vaccinated. So the vaccine, in essence, creates a copy, a photocopy, and an ability to fight the virus by creating something called antibodies, rather like soldiers in an army fighting against the virus. It's worth noting that the vaccines do not alter your DNA or genetic material. The vaccines do sometimes have side effects, but most people are absolutely fine. And even if you do have side effects, then these are very mild and not long lasting. So simple things like paracetamol, fluids, and a bit of rest is all you need to get through the immune response that your body is building and the side effect that you may have as part of that. So let's move on to the most exciting part and why we're all here today. And this is answering some of your questions about the COVID-19 vaccine and Ramadan. Again, just need to remind people that this information is correct as of today. And I want to encourage people who are watching us live to let all your friends and family know that this is going on. Please watch back if you need to, but also interact with us. So you can submit your questions, and we've got a wonderful panel who will do their best to answer these questions. Let me hand over to our first speaker, and that's Najib, who will Qari Yasim, who will answer the first question for us.
Assalamu alaikum. Good evening, everyone. Thank you so much, Mo, for the introduction. Obviously, the month of Ramadan is about to start very soon, and it's a month of shared humanity, spiritual upliftment, and therefore people tend to focus on their spiritual aspect of their lives. We are still faced with this pandemic, and therefore the questions tend to be, will the COVID-19 vaccine invalidate my fast? So firstly, before I answer that question, just want to focus on this point about whether the vaccine is halal or not. The scholarly bodies, whether it be BIMA or MINAB, we have looked into the substances of these vaccines, and we are confident that the vaccines used in this country are halal. They are permissible from Islamic perspective. They do not contain any human embryo or animal product or gelatin or alcohol, and as a result, it's absolutely fine from religious perspective to use the vaccine. Next question is, will the COVID-19 vaccine invalidate my fast? So the COVID vaccine can be taken during Ramadan whilst fasting. And the majority of the Muslim scholars in this country and abroad believe that taking the vaccine during Ramadan whilst fasting does not invalidate the fast. And this is not something new. This is a classical position, in particular in the fiqh Hanfi, which is the fiqh that's adopted by the majority of the Muslims across the world, and that is a classical position. Having said that, even the scholars who believe that taking the vaccine may invalidate the fast, they believe that you should still take the vaccine in the month of Ramadan, but just make up the fast at a later date. And that's a critical point. So in a way, all of the Muslim scholars agree on taking the vaccine whenever you are called to do so in the month of Ramadan. But some believe that if you feel if you feel that it's important, then you should make up that fast at a later date. And that's the minority opinion, whereas the majority opinion is that taking the vaccine whilst fasting in the month of Ramadan will not invalidate the fast. I'm going to hand it back to Mo.
Thank you so much, Qari Yasim. And we are blessed to have religious scholar with us to reassure us about the permissibility of the COVID-19 vaccine during this blessed month of Ramadan. The next question is over to me to answer, and this is really about whether or not you can cancel your vaccine appointment, whether this is the first or the second dose appointment, and have it after Ramadan. My plea to everybody is that they come forward when they are invited for their vaccine. There is a huge amount of effort that goes into organizing your slot and the appointments, the clinics, and we do not know what will happen after Ramadan in terms of supply and setup and operationally across Leeds. It's really important that you have your vaccine, because we know that it offers protection, and it certainly offers protection from very serious illness and hospitalization. So really, if you want to observe the month of Ramadan and the full month of Ramadan, better to get your vaccine and avoid catching the COVID-19 infection and getting really, really poorly from that. So please do keep your appointment, and I am sure, and we will all advocate, we are all pushing the system in Leeds to make sure that, and in Yorkshire, so that we are accommodating for the month of Ramadan. So looking up and working up plans to make sure that perhaps we can move clinics, or certainly in Woodhouse at the Chapeltown area, we're looking at that so that we can accommodate perhaps. But all of these conversations are still happening, but I promise you that we will still try to accommodate as much as we can for Ramadan. So let me invite Dr. Najib to answer the next question. And this is very relevant. I'm in primary care where we're not wearing intensive PPE because it's not needed in the same way as perhaps our emergency department colleagues or secondary care colleagues are having to. So over to you, Najib. This is about, I'm a frontline member of staff, and wearing PPE, personal protective equipment, can make it hard to fast as I tend to get dehydrated, but I want to fast. Over to you, Dr. Iman.
Yeah, no, thank you, Mo, and again, thanks for inviting me onto this esteemed panel as well. It's a great opportunity to reflect on Ramadan and reflect on some critical issues around COVID and the pandemic and the vaccine opportunity. Around PPE in particular, I think this is a really tough question, and I think a lot of it would be reflecting on our personal experiences of utilizing PPE over the last few months anyway, and how tired or dehydrated we feel while we are wearing PPE. Essentially, we should use this opportunity for Ramadan coming up to start to speak to our managers from now to look to see if there's any provisions that need to be made to allow us to continue to fast as well as wearing PPE. So, for example, can we have extra breaks in between to allow us to have some rest outside the intensive PPE, and for basically acknowledgement to be made that people will be fasting and some provisions need to be made. It also means that if provisions cannot be made, then there needs to be some discussions perhaps with your own faith leaders to decide, are these fasts that you can then make up after Ramadan because of your obligation in preserving life within the hospital setting? So basically looking at the importance of the work that you do and the necessity of wearing PPE to allow you to protect yourself and your patients, and whether the fast can then be made later on. But that's probably some advice you need to take from your own leaders. But in general, keep the PPE, protect yourself, protect others, speak to your managers now, raise awareness of Ramadan as a really important, vital aspect for our spiritual and mental health and well-being that we need to try and observe, and can there be some provisions to allow us to continue to fast while also protecting ourselves? I hope that helps answer some of the questions. It might be that some temporary measures will need to be made of moving people on different kind of shifts and different kind of duties, but effectively this is an HR workforce management issue that needs to be engaged with from the start. Back to you, Mo.
Thank you so much, Dr. Rehman. The next question is, what is my duty as a Muslim around sharing information about the COVID-19 vaccine? And no other than over to Gary Asim, who's done some amazing work around this to help us. And his mantra I've seen in several places, but I will let him share that with you. Over to you, Gary Asim.
Thank you, Dr. Sattar. It's really important that we appreciate the complexity of the issue here. There are religious, moral, and also social obligations that we have as Muslims. Misinformation is wrong. Spreading misinformation is wrong at any time. In particular, from Islamic perspective, God Almighty says in the Holy Quran in Surah Al-Hujurat, saying that whenever you receive information that's not verified, then please verify it. Please check it before you share it. So I've been saying verify before you amplify. It's because we can very easily share information on WhatsApp and believe that actually that's absolutely fine. No, people will use their own judgment and therefore make their own decisions. And that's true. People should do so. But at the same time, before we spread the information. Before we share it on our social media or on WhatsApp messages, we should actually pause for a while and ask ourselves some certain questions. You know, has it come from trustworthy source? Does it look sensible? You know, and can it be verified? You know, this is some of the work that Department for Digital Culture, Media and Sports has been doing. Their campaign is Check Before You Share campaign, and it's very much based on the Islamic ethos that please, you know, check before you share. Misinformation can cost lives in this pandemic, and we don't only have a moral and social obligation, but actually an Islamic obligation to share information that's been verified. The Holy Quran says, "Fas'alu ahla dhikri in kuntum la ta'lamun." It says, please ask the experts if you do not know. You know, it's very easy for someone to actually make a short video and make it go viral, but the implications and the consequences of misinformation can be dire in the sense that it can cost lives. So please check before you share.
Indeed, absolutely love that, and I often say your mantra, Qari Asim, which is verify before you amplify, and a great mantra, really easy during this COVID-19 pandemic to get sucked into a misinformation pandemic. So really important just to take that step, just to think about whether or not you should really forward that message on. So thank you so much. The next issue we will go on to is lateral flow tests and whether or not they invalidate the fast. And I want to invite Dr. Henna Anwar, another star in the region. Welcome.
Welcome, and Assalamu alaikum, everyone. Thank you very much for inviting me to this talk. I think it's a really important topic, especially now, and a lot of patients are asking questions about this already. Before I answer the question about the lateral flow test, I would just like to say that we do recognise that it is a really difficult time. Last year's Ramadan and Eid took place during lockdown, really different to how we would normally do this. We're normally breaking fast with family, friends, and celebrating with each other. And I think we all as a panel really think it's important for people to get vaccinated against COVID-19 so we can try and return our life back to normal, and we can go on to celebrate festivities with our loved ones, which is what we're very used to, not only in our community but other religious communities as well. Answering the question about the lateral flow test, we know that Muslims will need to take these flow tests during Ramadan. The British Islamic Medical Association has reviewed opinions from lots of scholars, and they have said that they do not invalidate the fast. So as per the opinion of the majority of Islamic scholars, it's absolutely fine to do these tests while you're fasting. Thank you, Mo.
Thanks, Henna. Qari Asim, do you want to add anything to that, please?
I'll echo what Dr. Henna has said. You know, the majority of the scholars have actually said that it's absolutely fine to take the COVID test whilst you're fasting. And if somebody wants to wait and do so when they have broken the fast in the evening, then they have that choice. But ultimately, I think what we're trying to emphasize here is that the cardinal principle of Islam is to protect lives, protect the life of oneself and also protect the lives of others. And it's like saving the whole of humanity. So fasting is a devotional act of worship to gain closeness to God Almighty. And if by doing that we're neglecting our duty towards our own self and others, then that could potentially cause issues from theological perspective. So it's just like making sure that we are striking the balance in our understanding of the theological issues here. Really important.
Thank you very much. And I just want to share something with the audience and the panel. I attended the Dixon's Trinity Academy, a school just up the road from us, to donate some laptops through a a campaign that we've been running as some doctors, and there was a senior leadership, the head, the deputy head, doing lateral flow testing on the children. So it's so widespread now, and a very relevant question. So we're seeing lateral flow testing in many places, and very important to consider that question there. I do want to move on to specifics around the COVID-19 vaccine, its side effects, and whether or not that will break the fast. Over to you, Dr. Rehman.
Yeah, no, that's great. And I think there's another slide next, which essentially is taken again from the British Islamic Medical Association, that is help to kind of guide how we think about this. Now, one of the first things to remember is that side effects on these vaccines remains very low. You know, there aren't a huge amount of side effects. And the side effects are fairly mild for people that get them, similar to any other illness. And that's mild illness, which is how these vaccines work. You know, they're trying to create an immune response without getting the real infection. So you're going to expect to get some kind of inflammation responses. So some aches and pains, some fever, might get a bit of a headache, etc. So the way we need to think about this is, you know, do we feel when we are normally fasting in other times of, you know, in other Ramadans, have we managed to fast with a mild infection, a cold, and have we continued fasting? And if the answer is yes, then technically there's nothing to worry about the side effects, because most people will get mild side effects and can manage to fast anyway like they would normally. If, however, maybe you're somebody who is very sensitive to illnesses, and even in the past, you've had kind of a cold and had to stop fasting because you really struggled with the symptoms, then maybe that's something to consider, that if you develop those symptoms, you get unwell, then you break your fast, but then you make up your fast afterwards. It goes back to, you know, Qari Asim's point that preservation of life here is really important from an Islamic perspective. So the obligation to help end this pandemic collectively is really important. And we have provision within Islam to make up our fast if we get ill. So we should follow the same idea that if we feel unwell, that we cannot fast, we break our fast and make it up. That shouldn't stop us taking the vaccine. The side effects shouldn't concern us to prevent us from taking the vaccine, because we have provision within Islam to make up the fast if, on the rare occasion, we feel unwell enough that we have to break it after the vaccine. I hope that, again, makes sense. Again, the BIMA website has some great resources there as well for us to look through.
Thank you, Dr. Rehman. We'll just move on to where you can find more information about the COVID-19 vaccine specifically and in the context of Ramadan. And if you are observing the fast, here it's also worth noting that many of the resources have been updated for example, if you have diabetes and you want to fast, but also the relevance of COVID-19. So well worth using these resources. You can, of course, speak to your healthcare professional if you have concerns about the vaccine and during Ramadan. You can visit the British Islamic Medical Association website, and you can also get specific vaccine and Ramadan guidance produced by the Mosques and Imams National Advisory Board, MINAB. So we are about halfway through now. I know that Qari Asim will leave us in a short time. So I am going to just change a couple of the questions to bring them higher up in the second part of our session tonight. And do remember that you can still submit any questions that you would like us to answer, and you can do that by putting that in the chat box there. The next session and second part of tonight's evening event is really about common questions, the frequently asked questions that we keep hearing about the COVID-19 vaccines. It's worth noting that many of these questions we have collated, and they are from you, the community that we serve, and these are questions that people will find helpful if we answer them. I'm going to go on to The first question for Qari Asim, please, which is, are the vaccines halal?
It's a legitimate question, and I think it's great that people are concerned about the permissibility of the vaccine from religious perspective. And I can assure them that there is no substance in the vaccines that are being used in this country, both Pfizer and also Oxford AstraZeneca. They are halal from Islamic perspective. They do not contain any alcohol. And here I just want to make a point. I think it's been asked in one of the questions. Even if they contained alcohol to a degree, what Islamic scholars have established this principle that when the transformation takes place and the substance is changed to such a degree that it's no longer the same substance, then it is permissible to use that. So even though some of the medicines or some of the cosmetics that we use, use the term alcohol in them, they are not the alcohol that will intoxicate anyone. And therefore, it's an established Islamic principle that when the transformation is such that it no longer is the same substance when it started, then it's absolutely permissible in Islam, and there is no harm in using that. As far as human embryo or animal products are concerned, again, British Islamic Medical Association, Mosque and Imams National Advisory Board, many other religious organizations in this country and abroad have confirmed that there is no such substance. And actually, Minab ran this campaign where imams were taking videos whilst being vaccinated to reassure communities, to inspire confidence in them that actually, if imams are using the vaccine, then obviously they are confident that it does not contain anything that's impermissible.
Thank you, Qari Asim. I just want to follow that up with another question that just come through. This is specifically around eye drops and the permissibility of eye drops, using eye drops if you are fasting.
Thank you, Dr. Sattar. That's a really good question, and I think we often get asked this question. And so the classical Islamic position, according to the Fiqh Hanfi, it is that it is permissible to use eye drops while fasting, and by using eye drops, the fast will not break. It does not invalidate the fast, and that is a position that's established in Fatawa Hindiya, which is a classical Fatawa book. So effectively, using eye drops does not break the fast or invalidate the fast.
Thank you very much. That's really fantastic. I know that you need to go shortly, and we'll just move on to a few of the other questions with the panel. But before you go, I just wondered whether you could give us some concluding remarks from a religious perspective, some well wishes to the people that are listening and watching tonight, and some of your final thoughts about what has been an absolutely extraordinary year, 12 months to 14 months. If you're able to do that for us.
Sure, thank you. It's been an excruciatingly painful year for so many reasons. We've lost so many of our loved ones, and we believe that whatever we may have missed in wishing them farewell, that they will receive a much better reception by God Almighty in the next world, and we take deep comfort in that fact. Secondly, last year our fasting and month of Ramadan, in a way, we were not able to practice our aspects of our faith, whether it be Tarawih prayer or congregational prayer in the mosque, and that was extremely challenging, emotionally challenging. And this year we are able to perform Tarawih prayer in the mosque. We are able to go to mosque for congregational prayer. But what we need to take a vigilant approach. Going from before COVID and in this year, thinking that actually everything is the same. It's not the same. We are still in the midst of pandemic, and therefore we need to take those precautionary measures, ensuring that we keep the social distance, we wear the mask, and we protect ourselves and others. At the same time, I think not letting the sense of deflation overcome us. It's not going to be the same Ramadan. We're not going to be able to have the iftar, like communal iftars and iftar with our family members, but maybe taking deep comfort in the fact that during the time of the Prophet sallallahu alaihi wasallam, there were not huge communal iftars. There were not big iftar parties. There were not large gatherings. So in a way, it's going back to the time of the Prophet sallallahu alaihi wasallam, Prophet peace be upon him, and reinvigorating our spirit with that thought. Also, Ramadan is about isolation, and in a way, we are still partly in lockdown, and therefore it's not letting the sense of disappointment or frustration overcome us. Just taking it day by day and thanking God Almighty that we are able to practice some of our religious practices this year, and God willing, inshallah, next year we will come, this will come to pass and we will be together. But taking the vaccine is a vital part of the solution to bring an end to the cycles of lockdown and to be with our loved ones again. And if you have any questions about vaccine, please do ask others. I'm really grateful to NHS Leeds who have shared so much information to help us make an informed choice. We are asking people to make an informed choice, and I'm really grateful to my co-panelists who have been working tirelessly to actually help people make that decision. When people say that we don't want it now, as Dr. Sattar says, mean not now, but it's not like not now, not never, definitely. So I pray that God Almighty helps us to grants us relief from COVID-19 and helps us to be with our loved ones again very soon.
Thank you for that point, a reminder. And indeed, we will meet again, and no means not now. And we will leave no one behind, and this is why we continue to meet with you virtually, but also to continue to reach out to as many people as we can to reassure. And I think the evidence that we have at the moment is that the messages are getting through to those people who really need that, and cases of COVID-19 going down, and also deaths and complications that we're seeing also going down. So this is all really good news. Over to Dr. Hannah. The question that we're hearing is, will the vaccine affect my fertility?
Yeah, thank you for that, Dr. Sattar. So medical experts and scientists both agree that it is not possible for the vaccines to affect fertility, and there has not been any evidence or any reason to show that any of the vaccines can affect the fertility of women or men. There's no evidence to show that there's a theory that immunity because of the spike protein in the vaccine can lead to fertility problems. There's no evidence to show that. There's also no evidence to show that people that have had COVID-19 and are recovering from COVID-19, that they're having any problems with their fertility either. Now, when a new drug comes out onto the market, such as a new vaccine, it's quite standard practice actually for it to be not recommended to pregnant women straight away, or those planning a pregnancy when they're first issued. But now that we're getting more data available, the independent body responsible for assessing the safety of the vaccines, which is called the Joint Committee for Vaccinations and Immunizations, has updated its advice and says that there is no need for women to delay pregnancy after having the vaccine. So I hope that helps answer some questions. The other thing that I would say is, if you are concerned or worried about anything, just have a chat with your GP. We would be more than happy to reassure or provide more information if you need it.
Thank you beautifully answered there. Dr. Hannah, can you also let us know about whether or not the vaccines will change DNA?
Yeah, I think you touched on, so Dr. Sattar touched on this a little bit earlier. So in the very simplest of terms, vaccines work by basically teaching your body to fight the virus. And the way that this vaccine works is making a protein from the virus itself, and that's what creates the protection. The protein stimulates your immune system to make the antibodies and the cells to fight the infection. And actually, the components of the vaccine leave the body within the few days. They cannot alter the DNA. They do not alter the DNA. There is no possible way for that to happen. You know, I've seen some information flying around about vaccines changing the DNA, and I just want to provide that reassurance that that cannot and will not happen with the vaccine.
Thank you very much. And let's move on to whether or not we think that the vaccines are safe. Dr. Rehman, thank you.
So yeah, for me, this is a no-brainer. You know, comparing this to getting COVID, I know that COVID is not safe. The vaccines are. I'm very grateful, alhamdulillah, I've had mine. My parents have had theirs. And we need to understand the science behind this. You know, the trials that have taken place, I know it's had a lot more scrutiny in the public domain than normal trials for other drugs. And all drugs go through a trial process to look at safety. The trials for the Pfizer, BioNTech, as well as AstraZeneca, they've been in massive trials because there's been so many people with COVID. So there's been no shortage of recruiting people for these studies. And these studies have shown that they're safe and effective. As with all drugs, as we monitor them through time, you might find different side effects, but it shows the system for monitoring any new drug also works. So, you know, really, I just want to reiterate that the vaccines are safe. The trial data demonstrates that they are safe. The people who normally look at trial data, as independent people who look at trial data, agree that these are safe. And they've not followed any different process of screening or accelerating these drugs compared to other medications. You know, they follow the same kind of due diligence and process to make sure that safety is preserved. So, yep, as far as I'm concerned, the vaccines are safe, and the systems to protect and monitor for any problems happening with any new drug, those systems are still working. And I think that's really reassuring for me that actually, you know, I'm happy with the processes that are ongoing at the moment.
Thank you, and I just want to echo what you have said, that that there are no serious reported concerns with the vaccines that are currently available and part of the vaccination program in the UK. It is a dynamic process, and we will put the brakes on if we feel that there is a serious concern. When we are injecting and jabbing people in the vaccination clinic, there is due process and check, check, and check again. So I want to reassure people from that point of view. And it is a great achievement that in the UK, we are now over half of the population has had their first vaccine, and there have been no reported worries around that. I can talk from our own experience at the vaccine clinic that I'm sitting in right now, and I've not heard or seen any major complications or problems. And as Dr. Rehman says, there is due process in terms of if there are problems with a vaccine or we need to report something, then there are specific websites where we're able to do that in a timely way and manner. I think the other thing to say is that there have been many organizations that are involved in signing off and making sure that vaccines are safe, and we are happy for them to move into phase 3 and also be used on the general population. And that's everyone from the MHRA to NHS England and even Health Education England. So that is what.
Sorry, you reminded me of something now when you talked about you know, your experience in the clinics. One of the things I've been asked is, how come people, before they are given the vaccine, they're being asked questions like if they've got bleeding disorders or allergies, etc. And I think, you know, for me, this again shows that we're practicing good, safe medicine. The same way that if you went to the dentist, you will often get asked certain questions about what medications you're on, what past medical history you might have, do you have any other bleeding disorders, etc. Taking these vaccines means that you're having an injection in the arm, and if you're on certain medications, you might need to be observed for slightly longer, and that's why you're being asked these questions. Or if you have significant allergies, then there might be some questions asked around the nature of those allergies. That doesn't mean that we are worried about side effects of bleeding or allergies. These are just standard screening questions as part of routine safe practice in administering these drugs. And I just wanted to reinforce and reassure that as well.
Thank you, Dr. Rahman. Brilliant. Let's move on to how were the vaccines developed so quickly? Over to you, Dr. Hannah.
So, I mean, we get asked this question all the time, and I think one thing that I would like to explain is when a drug is going through a trial, most of the time that is spent on that is recruiting the participants for the trial and actually trying to raise the funding for the trial. Now, with the COVID-19 vaccine, there was a worldwide collaboration and funding that was raised so quickly. So the global effort actually allowed the scientists to work very much at speed and complete years of what would normally take years. That was all done in months. The setup process was streamlined by establishing lots of people that were working together, meaning that the process moves through very quickly. And then, as you can imagine, this was just extraordinary circumstances. So under normal circumstances, the trials, the tests, they could have taken many years due to admin processes and other reasons as well, where we're just waiting when you apply for funding and then waiting for funding. And also a lot of time during doing a trial is spent actually looking for participants, whereas the response to recruiting people to take part in these trials for COVID-19 was just phenomenal. And thousands of people were recruited very, very quickly. So this wouldn't normally happen, and it would usually take a lot longer because people would have been not able to or unwilling. So for that reason, so there were no shortcuts made here. So all of the things that would normally happen during a trial happened. We went through all the phases. It's just that all of these other things happened so quickly. And, you know, I personally think it's a blessing that we had from the starting of the vaccine to actually getting the vaccine happen so quickly. So I hope that kind of explains something as well. And I just wanted to add one thing onto what Dr. Rahman was saying before about numbers of people getting the vaccine. So actually within our Yorkshire region, 98% of frontline NHS staff have had the first dose of the vaccine. So that may provide some reassurance to you as well. If, you know, if we're all getting it, hopefully that might make you feel a little bit more safe about getting the vaccine as well.
Thank you so much, Dr. Hannah. Let's move on to whether the Pfizer vaccine is better than the AstraZeneca, the Oxford AstraZeneca vaccine. Over to you, Dr. Najib.
I know, this is great, isn't it? We always want the latest model of something, right? Or my car or my laptop, whatever. So I think, again, this reflects the fact that we live in a time where we like to compare things, and we're very, I guess, we have a lot of information to go through. And this kind of scrutiny we probably don't have in terms of other things. For example, you know, what brand of paracetamol do we buy off the counter, or who's manufacturing my statin or my, you know, indigestion medications. We often don't think about that, even though there might be more than one manufacturer and version on the market. And I think we need to, this kind of links a little bit to the safety issue and the trials and the narrative around efficacy. So a lot of people are thinking, well, you know what, one is slightly different in terms of efficacy to another, but that's looking at efficacy in terms of getting COVID. Now, you have to remember that these drugs are not designed to stop you getting COVID 100%. That's very, very rare for any immunization or vaccination to achieve zero infection. What these drugs are really designed about is limiting severe illness and hospitalization. In that respect, all the vaccines, so even the ones that aren't yet even on the marketplace here in the UK, they are all equally good in stopping hospitalization and stopping severe infection. So even if you get COVID, so let's say few people who took Pfizer, maybe only a few of them got the COVID infection, maybe for Oxford, a slight few more got them compared to Pfizer. That's not the question we should be asking. The question we should be asking is, does it meet the objective of the drug? The drug is there to stop hospitalizations and severe illness, making it that if we get an infection, it's a milder infection. Both of them and all the other vaccines that are coming online are equally effective. So in essence, you take what you're given. There's no real difference. There's no real kind of better. The whole point is trying to move out from this pandemic. The quicker we get through our vaccination program, the quicker we can begin to think of how life would look like again. And we also then help to prevent further new strains developing and et cetera. So in my mind, there's no real difference between them. I would take whatever I'm given.
Indeed, and we are getting lots of questions around which vaccine am I going to be given, and is one better than the other? And certainly we are signposting and making sure that people know what they're getting as soon as they enter the front door of vaccination clinics, and also they have the information that is relevant to the vaccine that is being given that day. But in terms of which vaccine is one better than the other, actually, as a site, the vaccine arrives and it's just what we're given, and that is what we then give to patients. So there really isn't one that is superior than the other. And indeed, as Dr. Rehman has said, we need to protect and get out of this lockdown. Let's move on to the final question of tonight, which is, I've had COVID, and do I still need to get the vaccine? This again, Dr. Najib, thank you.
So short answer is yes, you do. We know that, why is COVID still such a catastrophe for ourselves? It's because we don't have immunity ourselves against this infection. We also know that immunity doesn't last long term. So even if you've had COVID before, your immunity can drop and you might get COVID again. So effectively, by getting a vaccine, you're protecting yourself against getting COVID again, and potentially even for some of other complications related to it. So short answer, even if you've had COVID, you're not guaranteed to be immune from getting the infection again. So therefore, you need the vaccine.
Thank you so much. I just wanted to pick up on a point that's come in, which is really around how do we know whether there will be side effects in 5 or 10 years time. I don't know if someone wanted to just comment on that. Happy to take any comments, Dr. Rehman or Dr. Anwar.
Yeah, so far, I mean, thousands of people have been given the COVID-19 vaccine, and reports of serious side effects such as allergic reactions have been really rare. So far, no long-term complications have been reported. But like any other vaccine or any other drug, in the whole world, they can cause some side effects in some people. We know that. That doesn't mean that anyone who's had the vaccine will get a side effect. It's also important to remember as well that no drug or vaccine is approved. In this country, it's the MHRA, the regulator, that approves the vaccine without it going through phases. And at every phase, safety is always checked and side effects are monitored. Now, I will say something else. We are seeing people that are suffering from long-term effects of having COVID-19, and we are seeing that now. So if getting this vaccine will prevent you from getting COVID-19, and I'm sure my esteemed colleagues will agree with me, we are already seeing people that are suffering from the long-term effects of having had the virus that are still not recovered yet. And that's just an important point to make about long-term effects of that. We haven't seen any of the vaccine, and we are seeing multiple people that have long-term side effects of the COVID-19, obviously alongside the number of people, unfortunately, that we've lost. So I hope that helps to answer a bit of the question there.
If I could just add to that, I think if we try and take a macro view, if we step away a little bit in terms of medicines and drugs and side effects, vaccines as a drug, these are amongst the most widespread class of drugs globally. Think of all the vaccines that are given for all the different kind of diseases all around the world, and compare that to any other drug. So vaccines are probably the most common drug that is used. And do we hear about huge amounts of side effects? The short answer is no, we don't. So as a class of drug, if we were to compare this to another medical drug, chemotherapy drugs or heart drugs or diabetes drugs, we don't use them in the same numbers and volume that vaccines have. And we don't see those massive complications or side effects. And the technology for these vaccines is nothing necessarily brand new. So as a class of drugs, yes, it's a new infection, but the class of drugs are familiar to us. So we shouldn't expect to get some new side effects in 5 to 10 years, because we've already had a proven track record of using vaccines for a long, long time, which is standard practice for infectious diseases anyway. So, again, we should feel reassured that this is a common, well-used drug methodology, which doesn't really have side effects. And I hope, again, that just adds to what my other colleagues have mentioned as well.
Thank you. We've had a question about who can people go to or speak to if they have questions about the coronavirus vaccine. Is it just your GP?
Hi, yeah. To answer that, there's loads and loads of information available online. If after you've read the information, if you're still not sure, then of course your GP would be happy to just have a chat with you about the vaccine. I'm not sure if there are any other advice. Is there? I don't think there's any advice lines as I know of, but there's certainly loads and loads of information online, and lots of NHS trusts are doing things like this. So I hope that, if you do have a question, that we've been able to answer it. If you're still unsure and you want to ask, then your GP practice will be more than happy to just reassure you about that. I hope that helps, Dr. Sattar.
And I think, Dr. Sattar, as you mentioned before, it's a dynamic space. I suspect that around the country, there'll be different measures in place to try and help provide greater advice, and maybe some other stuff will happen here in Leeds as well. I think, to reiterate the point about getting access to information, main thing, to follow on Qari Asim's point, is go to trusted sources where you can. So yes, there's a lot of online information, but go to the NHS websites or the British Islamic Medical Association's websites, or formal organizations that have really taken time to curate the information to make sure it meets the needs. And then speak to someone trusted. If it's not your GP, then another health professional that you trust. But I think that's the key thing. Trusted sources of information are important.
Indeed, and there may be people who are watching tonight that actually want to become advocates and champions for the COVID-19 effort that there is, and I am aware right now that there is opportunity to become a COVID-19 champion, vaccine champion in Leeds. So if you Google that, and you'll be able to apply and come forward to help communities. So that is one way that people are engaging communities. There's the radio. There is your newspapers and the media. There's also online, of course, as Dr. Henna was just saying. And also, let's not forget that many people are volunteering in the vaccination centres who are now also a wealth of information, and they'll be able to not only share some real facts, but also give you an idea of what to expect, and hopefully reassure you also as to what to expect. So we are coming towards the end of tonight, and I've absolutely enjoyed doing this. I want to take the opportunity to thank each and every one of our panel members today. Qari Asim, who has left the panel a short while ago, Dr. Henna Anwar, GP Registrar within the region, Dr. Najib Rahman, Emergency Department Consultant in Leeds. And let me also thank all those people in the background who have been working behind the scenes to make this a successful and a positive event. Let me finish by just giving you a few more tips on where you can get information, and the vital thing is that it's information that you can really trust. Please do take a look at the NHS website where you can get the latest information and advice, which is www.nhs.uk/COVID vaccine. In Leeds, we've also got a central information point that includes videos in different formats, that includes things like basic sign language, and you can head over to leedsccg.nhs.uk/COVID-vaccine. And as we've said before, please do check the source of your information that you receive. And if you are unsure, check the above websites, follow your local NHS on social media, or speak to a healthcare professional that you know. Let me just take the final word from each of our panelists tonight before we say take care, Allah Hafiz, and good evening. Dr. Henna.
I just want to thank everyone for watching, if you're watching now or if you watch this back, and I would really love to wish everyone a blessed Ramadan. I hope that you have a lovely Eid, and inshallah next year we can be fully reunited with our families just the way that we want to be. I hope you have a blessed and safe Ramadan.
Thank you, Dr. Henna Anwar, and we wish you the same. Dr. Najib Rahman.
Yeah, no, subhanAllah, you know, it's a trial, isn't it, going through this pandemic? But then we believe that all these trials come from Allah anyway, subhanahu wa ta'ala. And that's why we remain patient and steadfast in our hope and our prayers. And that's what Ramadan, for me, is one of my favorite times of the year. It allows me to reflect on my relationship with God and to get closer to Him. And in fact, last Ramadan was really good for the family as well, bizarrely, just in lockdown. We actually functioned really well and observed things really well. So perhaps we need to revisit what Ramadan means for us spiritually, what it means for us in our community, and what does it mean as our obligations to our community in the face of a pandemic and our responsibilities to that. So, you know, I'd like to kind of leave that on a reflective note, and again, wish everyone a blessed Ramadan and a blessed Eid, and one full of reflection and closeness to Allah subhanahu wa ta'ala. Back to you, Mo.
Thank you so much. Please do amplify, because we have verified the information that you have been given tonight. We've really enjoyed it. Know that we will be back with another Facebook Live on another topic, hopefully distanced from COVID-19, as the COVID-19 vaccination program is picking up pace, and the cases of COVID-19 infection are less severe and also fewer in number. From me and all of the Leeds CCG, I do want to wish everyone a Ramadan Mubarak, Eid Mubarak. Please take care, stay safe, and Allah Hafiz.